The Disruptive Dozen is a rank-ordered list of 12 closed-to-market cutting-edge technologies that leading Mass General Brigham faculty feel will have the greatest impact on healthcare in the next 18 months. Number 6. Gene therapies transform treatment of rare, devastating diseases. The first gene therapies were recently approved for clinical use in the U.S. This remarkable advance, which has been several decades in the making, means that one-time, potentially curative treatments for rare, life-threatening conditions are a reality. Now, a wave of other gene therapies is cresting, bringing transformative new treatments to the clinic. One is for a previously untreatable and often deadly disease known as Cerebral Adrenal Leukodystrophy, or CALD. This genetic condition primarily affects boys and involves the progressive loss of the protective coverings around neurons in the brain, causing significant cognitive and motor problems. If left untreated, patients succumb to a vegetative state and die, usually within the first decade of life. With newborn screening for the disease-causing gene, it is now possible to identify children with CALD long before symptoms appear. And with advanced brain imaging methods, clinicians can closely follow patients' health and determine the ideal time to administer gene therapy. Together, these tools promise to significantly reduce, if not eliminate, the burden of this devastating disease. Another transformative gene therapy on the horizon is for Hemophilia A, a chronic bleeding disorder that is expensive and often difficult to manage with existing treatments. Today, most patients require frequent injections of a synthetic blood clotting protein in order to prevent dangerous bleeds. That treatment can cost hundreds of thousands of dollars per year. When factored over a lifetime, patients can pay millions to keep their condition in check. An effective one-time gene therapy offers the possibility of a better quality of life, as well as significant savings both for hemophilia patients and healthcare systems.
These disruptive dozen gene therapies that transform the treatment of rare, devastating diseases is one of the biggest promises and breakthroughs that is accompanying the new developments of gene therapies that are coming available to patients. In particular, the ones that we're referring here is gene therapy for cerebral adrenal leukodystrophy, a devastating disorder of the brain that causes loss of all neurological function or death in few years and affects mostly boys, as the disease is X-linked and boys do not carry an extra copy of the X chromosome. The gene therapy consists on bringing with a vector, a vehicle, the normal gene into the cells that produce the circulatory immune cells. And by correcting these cells, we can halt the inflammation in the brain that is causing the destruction of the myelin. So far, there's been 2 trials, and the second one is ongoing, and the preliminary results published in the New England Journal of Medicine already show that this therapy will be changing the life of these patients. These boys are now preserving their neurological function and being able to halt the disease that is treated in early stages. Not only that, they are sparing themselves from side effects that a standard therapy with bone marrow transplantation with a donor bone marrow will bring, like graft versus host disease and prolonged immunosuppression. For hemophilia A, a disease where a clotting factor, factor VIII, is missing, and patients suffer from frequent and sometimes life-threatening bleeds in the joints and the brain and other parts of the body. The promise of a different strategy with the vector vehicle, but this time injected directly into the patients, an adeno-associated viral vector that changes the liver cells and inserts the gene or the messenger to produce the factor VIII that is needed to levels that will halt altogether the bleeding predisposition. Some of the obstacles of these therapies is going to be the access to complex medical care, how to make it available globally, as well as immune response against these vehicles and the long-lasting effect that this replacement, rewriting of the DNA of a human could have, which are still unknown to most of us.